Now, recently what happened is the threshold to treat thyroid disorders has declined, right? Like it is 5, even it is 4.5, it is considered as borderline, and that is also indication for administration of antithyroid drugs. And in pregnancy, it should be low, it should be below 3. And in Indian conditions, we hardly find wherein the TSH is below 2.5 or 3. So you will find that now the ANC, earlier in ANC, we have a lot of ANC cases also. We give them Shatavari Grita and all Masano Masika Garbha Paricharya. But we find that earlier they used to have one folic acid only. That was only one tablet that was given to them. Right? But now what has happened? Now this thyroid tablet has also become a very essential part of that. So the threshold to treat thyroid disorders has declined, and this is because untreated thyroid disorders, they threaten fertility and pregnancy, and it affects the brain also. So that is why we found that the threshold has gradually declined in the recent period. Now this is the case. The age was 30 years. The TSH was 10.46. Then giving the same tablet, we reduced it to 4.53, 4.53, right? So that is in a period of only 2 months. She was also very eager to conceive. And after this, she could conceive, and she gave birth to a very normal child. The third case is the hypothyroidism in premenopause or menopausal women. Here we find that in this case, with the same medication, the TSH was 11.22, then 12.53, then it came to 6.17, and then to 3.38. So it took almost 2022, we started the treatment, and still we are treating it. So what we found is that in the early age, that is in the second or third decade, we find that the results are very fast. But in the premenopause or the perimenopause, the results are a bit slower. One example I have taken, but I have a data of almost more than 200 patients with all records. And in another case, we found that in the male case, the TSH was exorbitantly high. It was 242. And his age was around 30. Then we started with the same treatment. Then we found that it started decreasing. In the first 2 months, it came to around 140. Then it decreased to 60. And then it came to around 10. The reason for which he had come for treatment was for Vajikarana treatment. He was around 28 to 30 years old and married since 5 years. So his sperm count has reduced. Now, when we treated with this same pill and decreased the TSH levels, then we found that his sperm count has also increased. That is what is told in the modern books also. Right? This is the one aspect. Now we will try to find what we used in these conditions. This was again a pre-pregnancy condition, 23-year-old. TSH was just 6.78. See, for normal it is 5, but for pregnancy they are considering it as 2.5. It should be less than 2.5, right? Otherwise they will give another pill. So that reduced to 4.84, right? Then it gradually got reduced to 3. So now, what is the basis of treatment? How to proceed? How I got results with this? The only drug which I'm using in that condition, with some additions of some kashayas if required, that I will tell in the later stage. See, like whatever you require today, information, what you do, you refer to, you Google it, and you find a lot of information. So our website is what? It is Charaka Samhita. I hope you will agree with that. Charaka Sushruta and Vagbhata. So, how to proceed with? Is there any disease which is named as hypothyroidism or hyperthyroidism? No. So, when you don't know anything, there are a lot of methods mentioned in Charaka, right? It's a huge treasure. Yadi hasti tadanyatra yanne hasti natat kvachit. So, I found this method to be very effective. See, when you don't know anything, right, how to proceed? In hypothyroidism, it is like prameha. It is hereditary. How is prameha? Sthula pramehi balavani haikaha. Krishastataiko paridurbalascha. See, one is sthula pramehi, another is krisha pramehi. Right? So hypothyroidism also, one is sthula, a person is having hypothyroidism with high TSH levels, he is sthula, and another is krisha also, but majority are sthula, what we got in our OPDs. So, where is the concept wherein a same disease afflicts sthula as well as krisha? There are two types of vikaras, upakramyasya hi ditva dvidhaiva upakramo matah. One is santarpana sadhya, another is apatarpana sadhya, but one disease fitting in both. Right? It's the nature of the disease. I don't have answer for that. Like prameha. Prameha occurs in krisha as well as sthula. So hypothyroidism also occurs in krisha and sthula. Who told you? So first chapter is the Yojana Chatushka. It begins with what? It begins with the concept of Ashtavanindita. See, in Ashtavanindita he says, see, we have discussed a lot about the Bheshaja. We will now discuss about the Yojana. What is Yojana? Yuj Dhatu means Sanyoga. Sanyoga of what? Sanyoga of the Dravya with the Roga. The Sanyoga of the Dravya with the Rogi. Right? Sanyoga of Dravya with Roga will not fit fine because in Sanyoga of Dravya with a Roga may find that this is the best medicine for this. But the person, if he is of Pitta Prakriti, and you find that a very Chitraka like Ushnavirya Dravya is best for the Roga, are you going to administer it? No. Even in Shodhana also, there are a lot of contraindications. So, first we have to see about the Rogi. That is why Charaka has mentioned Ashtau Nindita. Ninditiya means what? It refers to the Purusha. Again, for Purusha means it refers to the Sharira. The Sharira is of two. One is Sthula and another is the Krisha. So this is the basis. So, what we are discussing today is Santarpanotha. Santarpanotha Sthula cases which are having hypothyroidism. Right? Apatarpanotha, Krisha, having hypothyroidism is the second group, which is very difficult to cover. Only this aspect I have covered in today's presentation and some other endocrine disorders. So Charaka has clearly told, Sacha Yojana, Shariram, Apekshata. So, Sharira Apeksha, it does the Apeksha of Sharira. That is, considering the Sharira, we choose the drug. As I told, all these cases were of what? All these cases were right. So all these cases were what? They were Santarpanotha Vikaras. So in Santarpanotha Vikara, so in Santarpanotha Vikaras, what he has mentioned, right? You know, Prameha Pidika, Shopa, right? Atistholya, all these vikaras have been mentioned. So as we discussed, as we saw earlier, and you all know that in majority of the hypothyroidism cases, their stholya will develop, the puffiness in the face, right? They are all indicative of what? Majority the Santarpanotha, stholya, then Shotha. In many cases, we find Shotha as a very predominant determining factor for which you go for thyroid profile. So the next is, after Ashtavaninditiya, is the Langana Brahmaniya Adhyaya. What is to be given when it is Santarpanotha? Definitely it is Langana. That is the second chapter in Yojana Chatushka. The third chapter is Santarpaniya. Santarpaniya, see, one is Ashtavanindita, you differentiate Sthula and Krisha. The next you decide what is Langana and what is Brahmana, which Langana you have to adopt and which Brahmana you have to adopt. The third is Santarpaniya, means what Santarpaniya means what actually happens inside. Whether what you decided and what you gave, it reduced it or not. Whether Santarpana happened or Apatarpana happened. When you meet your friend after several days or several years, they say, Arey, you have become fat. Arey, tu patla ban gaya, tu mota ban gaya. So how they say? That is not Langana Brahmana. Langana Brahmana is what he has taken. Santarpana, Apatarpana is what has happened. Right? So these are the three chapters. Right? After that comes the Vidishonitya, which is a totally different Shitoshna Snigdha Rukshadhya, Upakrantashtaya Gadaha Samyak Sadhya Na Siddhyanti. That's a different aspect. So these three chapters are definitely going to guide you in every disease and definitely in case of what? In case of hypothyroidism. Now, when we decided that it is Santarpanotha, then what are the karana that are mentioned for this that we commonly found in our patients? Right? They are Adhyashana, Ajirna Bhojashana. So, what is Adhyashana? You know, right? When person takes food, when the previous food has not digested, Adhyashana is now considered to be the most common cause for all Santarpanotta Vikaras. Now, people tell we take very low calorie diet, but what they are taking the diet again and again. 2 snacks, 3 food, right? What happens because of this? Right? What happens because of taking food again and again? They will say, why you are worrying? We have money, we have appetite. If you don't appetite, you do upvasa. Why are you forcing us not to eat? See, okay, you are getting appetite every time. You are eating 5 to 6 times. Now, what really is happening? Right? You know that the Madhura Ahara Rasa is formed. Where? In everyone. That is the normal physiology of Ayurveda. No? Now, what is the pathology? Right? Ahara Rasa is formed. It is of Madhura Rasa. But what happens in Santarpanotta Vikara is that the Ahara Rasa becomes Madhura Tara. Right? You are getting? The Ahara Rasa becomes Madhura Tara. That is what? It is more capable of increasing the Snigdha dhatus like Mamsa, Meda, even up to Asti Majja and Shukra. But you know that in Sthaulya Samprapti, what really happens is there is Avarana. Avarana of what? Avarana to the other Srotamsi, as a result of which Meda Eva Upachiyate. This is the basic physiology I am telling what really happens in Sthaulya. The same mimics in the hypothyroidism. Right. So, this is one part. Now, the question comes, so your understanding now, if you have any doubts, you can ask in between. Right? Because we are like exploring how we can approach this disease. Now, you told all the pathya and all. The basic problem here is that such people, the people who are sthula, they are having Deeptagni or Mandagni. Sthula, right? Generally, they are having Deeptagni, right? But now, what really is happening here in the case of hypothyroidism? If he is having Mandagni, Tikshnagni, he should again take food, digest it, then he will remain swastha only. Now, where lies the pathology? Right? Where is the problem? See, the problem is there. What is happening? He is becoming more sthula. He is not swastha. He is not having samasthula krishatva. He has become ati sthula. Shodha-like symptoms are also seen. They become lethargic. Hypothyroidism, they become lethargic. They develop fatigue. They develop, even the depression and other symptoms. Why? Right? So, some problem, some Sroto Vaigunya is happening. No? This Sroto Vaigunya has been very finely identified by Dalhana. What he says, Deeptagni is to be found in Stula. Even though Stula occurs here, why there will be Dhatu Vruddhi or Dhatu Dushti Lakshanas are seen? This is because there is a Dhatvagni Mandya. Swasthanastasya Kayagne Ramsha Dhatushu Samshritaha Tesham Sadati Deeptibhyam Dhatu Vruddhi Kshayodbhava. So what really happens is, here is, there will be Meda Dhatvagni Mandya that leads to, whenever there is a Dhatvagni Mandya, it leads to Dhatu Vruddhi, and Dhatu becomes Tikshna, it will burn away that Dhatu. That will lead to Dhatu Kshaya. This happens typically in hyperthyroidism. In hyperthyroidism, there will be Dhatu Paka. In hypothyroidism, there will be Dhatu Vruddhi. Tesham Sadati Diptibhyam Dhatu Vruddhi Kshayodbhavaha. So this is the basis on which we have to proceed in the cases of hypothyroidism, in which I proceeded with the selection of the drug and the administration. Right? So, what is told here in this context is that the Lakshanas. Now, why we should not neglect such conditions? Santarpanottha Vikara having Sthaulya and all. Because the first aspect is that Kshipram Avishanti. The Santarpanottha Vikaras are capable of causing damage immediately. Like you say, a person was very healthy, he suddenly developed a heart attack, he developed a stroke. So like that, the nature of the Santarpanottha Vikara, because of Avarta Marga, is that Kshipram Avishanti. They have a nature to vitiate immediately. That is one aspect. And because of Meda Dhatu and all, he develops Sarva Kriya, so Asamarthaha, Anya dhatava na apyayante. Alpapranaha bhavati. He appears to be very fat, but he is not capable of doing physical work. Why all this? These are all because of this, in detail explained in the Samprapti. Now, the drug which we choose in this condition was Shilajatu, Guggulu, Gomutra, Triphala. Various drugs have been mentioned. Now, what we found that in this condition, which drug we have to choose, right? Lot of drugs have been mentioned. So we chose Gomutra. Along with that, the research works has also shown that Haritaki, right? Single drug Haritaki in the experimental animals, the results have suggested that the extract may have beneficial effect on stimulants to thyroid functions, right? There was, it decreased the TSH showed a significant decrease in case of both low dose and high dose as compared to the control. So, Haritaki was a promising drug. Haritaki is mentioned in as a apatarpaka, that is, it can be given in Santarpanottha Vyadhi. Gomutra can also be given in this Vyadhi. So there is one very simple yoga which all our earlier Vaidyas used, and you all know, that is Gomutra Haritaki. So that's why we chose Gomutra Haritaki to be the best choice for this. Now, this was a Gomutra Haritaki that we used. It's a 300 mg tablet. The reference is from Ashtanga Hridaya, processed in Gomutra, Riverakvatha, Mishikvatha, and Kushtakvatha. But basically it is Gomutra Haritaki. You have to understand that it's boiled with the Haritaki is boiled with the Gomutra, then dried and given the Bhavana. Now, this Gomutra Haritaki is a 300 mg tablet. There are 500 mg 1 gram tablets also available. We chose this only. 1 tablet BD or 2 tablets BD. Discontinue during menstrual periods or Pitta Vriddhi or Jvara. And we have the reference in Ayurvedic Formulary of India also from Ashtanga Hridaya Uttarasthana. Right? There are a lot of references. As a part of the legal aspects that you may face in your practice is that the government has recommended that you should refer almost all your yogas from Ayurvedic Formulary of India. Even the pharmacies have to manufacture from AFI. You can manufacture from other drugs. You as a practitioner can also refer what? Any drug, right? Haritaki plus, Amlaki plus, Madhu is indicated. So you can use that. But now they are developing several SOPs. They are including a lot of drugs and formulations, right? They are recommending to use from AFI, right? They have given standard operative procedures for that also. So now, right. So this was the basis. So you got, so we started with the Santarpanottha, it considered it as a Santarpanottha Vikara and gave Gomutra Haritaki, and we got very extraordinary results with the administration of this drug. In some cases, we administered in the dosage of 2 BD or 1 BD was very effective. But in some cases, we took 6 months, 7 months like that. So that was because of the age factor or perimenopausal, that wherein we got results, delayed results. That is one aspect. In the cases wherein they are already taking the hypothyroidism drugs, then there also it is giving so extraordinary results, this Gomutra Haritaki. Say they are taking 150 mcg of the drug. People, the patients find it very difficult to take, especially the 125 mcg and the 150 mcg dosage. So when we started with this Gomutra Haritaki, we reduced within 3 to 4 months to 125 mcg. In almost a period of 2 years, we could reduce it to 25 mcg or 12.5 mcg, which is the lowest dosage that is given in hypothyroidism. That is, with a co-prescription, we can reduce the dosage, and in some cases, we can completely treat. And in the cases which have directly come to us, we were very successful in treating the conditions, right? But you should take care that here what we have treated is not in case of after pregnancy, right? It is only before pregnancy, those who came to us because of infertility and all, because it's very common cause of infertility. And it's very right also, I told you earlier in the cases that when we effectively treat the TSH levels, definitely the rate of fertility increases, right? So this is one aspect. Now, coming to another very important disease, right? That is Prameha. I will not go into the details because a lot of other people will be presenting on Prameha. We have a lot of drugs which we use for Prameha. I commonly use Shalasaradi Gana. You know, Shalasaradi Gana Bhavita Shilajitu is there. It's recommended in Vagbhata only. So we are using 500 mg or 1 gram capsule of the same. And we are getting very good results along with Nishamalaki. As per the requirement, we use as per the doshas. Now, these both combinations have helped us Which one? Shalasaradi, Ganabhavita, Shilajitu and Nishamalaki have helped us in getting very good results, like reducing HbA1c from 13-14 to 5-6, and those who are having 8 or 9 with very perfect diet. With only Ayurvedic medicines, we can bring it very well below 6. That's very much possible. And even we can reduce the dosage of the, in insulin dependent cases, we can reduce the dosage of the insulin. We can reduce the dosage of metformin or glimepiride. Especially we were very effective in reducing the glimepiride, glipizide and other drugs. By co-prescription of Ayurveda along with the metformin, we can reduce, we can totally stop those glimepiride and other drugs. Only with metformin, those who are having like 20 years, 25 years diabetic, we could very well maintain with this Shalasaradi, Ganabhavita and Nishamalaki. Now, what I am discussing you is the present case scenario, what we clinicians are getting. Now we have, sir, cases of diabetes wherein the HbA1c is 5.8 and 6. He is having Bahumutrata. We are having cases of 5.8 or 6 HbA1c. They are not having Bahumutrata, right? So how to decide? What to decide in this condition? I employ a very simple method. When there is Bahumutrata, it is a Prameha Lakshana. When there is no Bahumutrata, it is Prameha Purvarupa. What we clinicians are getting daily in our OPD, they will be not having Bahumutrata, right? But they will be directly having Padadaha. They will be having what? Shula, Amsa Shula and all, right? Where all these come, right? They all come where? In the Prameha Purvarupa. So Prameha Purvarupa is very important to diagnose. What cases we are, don't wait till the Bahumutrata comes. So what pre-diabetic, the term was coined when we were studying. So I'm very fortunate today. My friend, after he has met after 2 decades, Dr. Santosh Bhatted, he is working in All India Institute of Ayurveda, New Delhi. So he did his post-graduation in Jamnagar. His presentation is there after mine. So at that time, the conditions was very totally different, right? So now the conditions have changed. At that time, only FBS, PPVS was important. Now HbA1c came. Now HbA1c is also gone. Why I'm telling you? Because where it will end. I'm not explaining about a modern thing. I'm explaining about a very unique Ayurveda therapy and a unique Ayurvedic principle. What is that? So now there are a lot of cases I told wherein the HbA1c is within 6. They got stroke. Then somebody will tell, no, that is because his hypertension was not under control. Like that they are telling. Now the concepts have changed. Now what patients are bringing, or now the current trend is that check the triglyceride to HDL ratio. You know triglycerides. They are the endogenous, exogenous triglycerides which are produced from the liver, packed and sent to the peripheral tissues. From peripheral tissues, it comes to the, it is brought back to the liver and excreted. So what is the factor responsible for that is HDL, right? They are all lipoproteins, you know. So so most of the patient come and show us their lipid profiles, right? This concept is that triglycerides divided by HDL. So that gives a value. Now this was a case wherein, a diabetic case, wherein the HbA1c, right? HbA1c was within 6, but she was having Bahumutrata, one aspect. Padadaha was there. She told, sir, as my diabetes is coming under more control and the more diet I am doing, the more suffering I am having. What is responsible for this? Is there anything, something different? See, when we take these values, triglycerides divided by HDL, it was 7.76, but HbA1c was under very much control. Then what it indicates? So as per the recent trend, triglycerides divided by HDL indicates insulin resistance. So they say HbA1c is not enough. Your HbA1c is under control, but you are having insulin resistance, means what? Right? So this is one aspect. Now in this case, we gave this drug, Nirmeda, right? We gave this drug Nirmeda. It contains Vyoshadika Gulu, Shuddha Shilajitu processed with Agnimanta, Sagnimanta Rasohitaha, I told earlier in Santarpanotta Vikaras, along with Vacha and Lashuna. Vacha is said to be a Lekhana Dravya mentioned in Sharangadhara Samhita. In the Shloka only you find the reference. And Lashuna, common drug indicated in the Medagata Vikaras, right? So in this combination we gave, right, 1 BD or 1 TDS dosage we generally employ. In this case we gave 1 BD in a, say, in a period of 4 to 5 months, right? we got the triglycerides reduced from 404, they got reduced to 157, and the HDL rose to 54. The ratio, which was 7.76, got reduced to 2.90. Right? This indicates that even though the HbA1c is under control, but there was insulin resistance persisting, and that also got reduced when we employed this yoga from the Santarpanotha Vikaras. Right? You got the point. So this is the latest trend of the what is going on. See, if you bring the sugar under control, the dakshinas are under control, then the people will say, or the faculty of other doctors will say, no, lipid profile is wrong. You will suffer from something in the short period. So something will happen. Then they will say, sir, your drug was good, but lipid was not under control. So why I'm telling you is that, what is the basic fundamental aspect again in all the Santarpanotha Vikaras? To prevent complications, what is the fundamental factor? That we will come at the end of all these disorders. All these disorders, they fit under one thing, that is Santarpanotha Vikaras. Now, we have the cases of uterine fibroids. Uterine fibroids is nowhere related to metabolic disorders, yes. But what the recent trend is that uterine fibroids are not endocrine disorders, but they are strongly influenced by hormones and can be affected by endocrine disrupting chemicals. Right? So, it is a gynecological disorder with a significant endocrine component. Right? So you know the various types of fibroids that we treat. So they are generally accompanied with heavy and prolonged menstrual bleeding, and sometimes very big clots. There will be pelvic cramping and pain during periods, and even pain in the lower back, even in the absence of periods also. Some develop constipation, but typically Atyarthava is very typically seen in this condition. So this was the case of 2.1 to 2.6 centimeter. So I have compiled only the most recent cases which we treated, right? So in a period of 1 year, it got reduced by 1.3 to 0.9 centimeter, almost a decrease of 1 centimeter. And this is a case of 1.8 to 1.2 centimeter, very recent case. So in a period of 8 to 10 months, it totally couldn't be seen in the next USG. So you can see here 1.8 to 1.2 centimeter in 16/1/2025. So in 2025, the fibroid has totally vanished from the report. So how to treat this condition, right? As I told you, why we're including in the endocrine component? It's not mentioned in Ayurveda endocrine component or endocrinology, right? See, as per the new studies, it has an endocrine component, because estrogen and progesterone, they influence the endometrium, they influence the uterus, and hence the structures also. So now, what is told about this Rakta Atyarthava? It is very common diagnosis, that is the Rakta Pradara, right? Chaturnam Pradaranam cha tatsarvam karayed bishak Rakta Atisarinam yaccha shonita pittinam Raktarshasam cha yat proktam bheshajam tacha karayet. So this is all the treatment, what treatment you adopt for Rakta Vikaras. They are all the treatment in this. So what we used is the Nagakeshar along with a drug called as Khun Kharava. So earlier, the Vaidyas of Jaipur, they have a tradition of using this, all that Bola Baddarasa or Shuddha Bola was used. Shuddha Bola was mixed with Nagakeshara, and it was administered in uterine fibroids. That gives very good results. But in the recent period, what has happened with the Comifera Mir, that is the Bola, it's not genuinely available, or its efficacy has reduced, or more apathya people are taking, and that's why we require a more stronger drug. And a stronger drug available to us is the Khun Kharava, the dragon's blood, right? So Demonoropes Draco, it is called as dragon's blood. So Nagakeshara along with the Khun Kharava, we used it. We use in almost all cases of Rakta Pradara, whether it is fibroid or non-fibroid. And when there is excess Raktasrava, right, for say 15, 20 days, then we start with the Udumbara Shalatu Swarasapana, that is Udumbara, right, tender leaf of Udumbara, right. The Swarasa is taken, immediately the Swarasa is prepared, and Abhaktavastha in the morning 9 a.m. we give the Udumbara Swarasapana, right, say 20 ml, 25 ml, depending on the Agni, say for 10 days, 15 days, till there is complete cessation of the bleeding at least, right, and weekly twice Eranda Taila on empty stomach for Vatanulomana, right. This is a case of Atyarthava. So they told there was some problem with the fonts. So this is a case of Atyarthava at age 41, right. So having Atyarthava, so we gave Abhyantara Doshapachana with Nagakeshara. With Nagakeshara, we use Anupana as Navnita. So you know the qualities of Navnita, no? Navnitam Navamrusham Shitam Varna Balagnikrit. Navnita is what? It is Raktastambhaka. It is of Shitavirya, right? Having very unique properties of Raktastambhana and Sthanika Yoni Pichu Dharana. So actually the case was of a myometrium, a sign of adenomyosis. So tiny intramyometrial cyst 7 millimeter, Nabothian cyst, endometrial lining or thickening was, endometrial thickness was 20 millimeter. That's why she was having Atyartava, and she was advised hysterectomy. So we gave this treatment, what I told you earlier. So post-treatment radiological report showed normal size uterus and endometrium and no lesions in myometrium and endometrium. These are the reports of the patient, right? So this became possible because of following the one of the very important principle of Ayurveda. It is not the Raktapitta Chikitsa or the Udumbara Shalatu or the Nagakeshara or the Navnita, what I told you earlier. They are all Bheshaja. What is the fundamental principle in treatment of Rakta Pradara? Right? You got the point. I told you the drugs. You will note it down, but it may or may not give result. If you want result, what to be done? Right? In all these cases, what is the main basis? The basis of Ayurveda is Kaya Chikitsa. And what is Kaya? Kaya is Antaragni. Kaya se Antaragni Chikitsa, Kaya Chikitsa, depending on the Agni you have to give. That is one part. Here, the important aspect is that the first line of treatment in all Raktacha Vikaras is Yacha Shonita Pittinam, Rakta Atisarinam Yacha. It is clearly mentioned, no? What I told you earlier in the treatment of Rakta Pradara. The treatment of Rakta Pradara says that since there is Prayanahi Samutkishta Amadoshat Sharirinam Vriddhim Prayati Pittasar Praktasmil Langyam. The first line of treatment in Rakta Pitta is Langhana. So what is Langhana? So what Upvasa we adopt here is that take food by 12 or 1 p.m. We ask them to wait till he gets very good Agni and then ask him to wait till he becomes Atibubukshita. At that time he has to take food, means dosha pachana will happen, right? Whatever you called as the upadoshas or the kapha or the meta dosha will be there, the paka will happen, so that when we administer our drug, it will be very effective in getting our results. So that is the Pachana Chikitsa which we adopt in such conditions. That is one aspect. Another most important aspect is that another case of fibroid. So she was a bank manager, 43-year-old. The case was very different. She came to OPD for this treatment, and along with she had another problem. It was a legal problem. What was that? She had slapped her assistant, that bank manager. She has slapped her assistant. Why? Then she told, he gave in letter, he put a case on her. She gave in written that this happened because of hormonal imbalance. Right? Then they told, you take rest, take hormonal treatment and come back. But she took rest, but she couldn't get success. She couldn't get relief in her symptoms. Now, what we did in this condition was that okay, thank you. So what we did is that the most important aspect which we miss, like I told you earlier, in Rakta Chikitsa, the treatment is Rakta Pitta Chikitsa. What is the treatment in Rakta Pradara or any Arthavagata Vikara is that there is something called as Sravakalina Charya. You got Sravakalina Charya. So lot of, in the morning session also, Dr. Manjunath sir told that we have forgotten lot of our natural things or nature, and he also told don't try to find the nature of the nature. He told very beautifully today morning. So we have to find the nature of the Arthava. What is it? How it comes out? So in that context, whatever Ayurveda, the contribution of Ayurveda is that they have mentioned a Sravakalina Charya, wherein a 3 days absolute rest is there. This was followed in the earlier times, now it has vanished. Now in this case, what I told her is that, so when she came, she has started with the periods. I asked her, you take absolute rest for 5 days. The rest should be such that you should not even get up. You should go only for Vega Vimokshana. Otherwise, there is no need to get up. You take food. What food I should take? Payasam is only food, right? Stop all the food. Payasam means what? Rice plus sharkara plus ghrita plus dugdha. Sakre payasa, right? Anna sakre payasa is there. So this payasam when we have to give this payasam, when she gets appetite. So got appetite in the morning 9 a.m. we gave this. In the evening again we gave this. Next day also we gave this. So in 1.5 to 2 days, the Raktasrava decreased. The next one, the same month, That means after that periods, the next periods, her pain and her problems and her srava has reduced to almost 80%. Only by following this Ravakalina Charya, we could get very extraordinary results. Why this became possible? This became possible because we always skip the basic treatment, right? We can treat Jwara very easily. Even if it is a typhoid case, the treatment is Langhana. When it is case of Rakta Pradhara, we miss the Langhana. When it is case of Rakta Pradhara, the first treatment is Ravakalina Charya. We miss it. So we should never miss the basic aspect, right? Earlier, from Vyasa, sir also told that a lot of researches have taken place regarding the Brahmi Muhurta Utthana and all. So they also influence. If a woman or a child having any disease, say, if they wake up early and go to bed early, that is the most common principle, early to bed and early to rise, that can bring miracles. We have forgotten that. That is why we have forgotten the nature. Idam agamashilatvat pratyaksha phaladarshanat mantravat samprayoktavyam na mimamsa kathanchan. So this Ravakalina Charya is very important. Now we have started adopting it in every condition, right? In every condition wherein the gynecological disorders, we tell you follow this Ravakalina Charya. This is what is mentioned in Ashtanga Hridaya, right? So correcting the beginning, we have to correct the beginning. In this case, another case, especially in married, is avoiding the Vyavaya karma. Tadevati prasangena pravruddham anrtavapi asrugdharam vijaniyat. The basic line of treatment is to avoid Vyavaya, and now people have forgotten this. That's why Ayurveda Vaidyas were very important in keeping the Vyavaya where in the Trivida Upastambha. Which are the stambhas? Which are stambhas? Vata, Pitta and Kapha are stambha. Upastambha are supporting those Vata, Pitta, Kapha are Ahara, Nidra and Abrahmacharya or Brahmacharya, whichever, both are correct. So contraindicated, that is avoiding Vyavaya, and then what we saw has happened, that is decrease in almost the intramural cyst, the adenomyosis, and the endometrial thickness of 20 millimeter that came to normal. That happened because of all this, right? So these are all the references. So what we need to understand here is that there is a basic difference, right? What Artava Srava occurs now, it has nothing to do with Rakta. Rakta is very different from Artava. Artava and Rakta are different. The Srotas for Rakta is Raktava Srotas, which takes origin from Yakrita and Pliha, which has nothing to do with Artava. And Artava, Vahanam Srotasam Garbhashayo Moolam, it has nothing to do with Yakrit Pliha. It is only when Vata becomes Dushta and takes the Rakta and it joins, it does the Yojana between the Raktava Srotas and the Rajova Srotas, and that is the condition wherein the Rakta starts coming out along with the Raja. Otherwise, it is just Rajasrava. It is just Rajasrava. If we see the most latest books on physiology regarding menstruation, in the last stage, right, how the bleeding stops, right? Even the blood vessels inside the endometrium, just behind the endometrium, they become what? They become shushka. They get dried out, so that the bleeding stops by itself. So what really happening here is, as per our text, is basically Artavasrava, Rajasrava, Masi Rajahastrinam, Rasajam, Sravatitraham. What flows out is a Rasajanya Artava, not Raktajanya. Rakta has nothing to do with it. This vitiation can happen only when there is a friendship or an interaction between the Rakta and the Artava Srotas, and this friendship is produced because of Vatalahara Sevinyaha. Ashtanga Sangra Vagbhata has beautifully mentioned all these vikaras are because of the association between the Raktava Srotas and the Rajova Srotas, which happens only because of Vata, and this has been very clearly explained in the Rakta Pradhara Samprapti and Chikitsa of Charaka 30th chapter, right? So again the last point, that is the Anarthavatva case, is PCOD, weight gain. So it's time is ticking because a lot of presenters are there. I'll have to complete. So in Anarthava case also, it is also Santarpanotha Vikara. They develop a lot of fat, their weight increase, they develop acne, right? There will be hair fall. So basically, what we concentrated in the cases of Anarthava is having PCOD and having weight gain. Now, what is the treatment? The best line of treatment is to give Tatra Agneyanam Dravyanam Upayogaha, which is the best Agneya Dravya. Starting from my treatment, from what I learned from my teacher, Professor Lakshmikant Dwivedi sir, he told me, Srinivas, the best medicine is like one is Ushna Dravya and another is Shita Dravya. I told, how, sir? So I was a student like you. I told, sir, one is Ushna and Shita means you are telling like estrogen and progesterone. Sir told, same way. There is a chapter called as Shatapushpa. and Shatavari Kalpadhyaya in Kashyapa Samhita, especially mentioned for the obstetric and gynecological disorders and infertility. See, Shatapushpa is Ushnavirya. He mentions Shatapushpa Tailapana. Then he mentions Shatavari Ghrita, which is again for Pana, and it is for Atirakta Srava. So my whole treatment is based on, I don't give any medicine in Artava without Shatavari Taila. So that was, so this is the, by these words, I complete my presentation. So if you have any questions, you can definitely ask. So the conclusion is that it's very simple, that we have to treat majority of the metabolic disorders which are having santarpanaka karanas as santarpanotha vikaras and treat by the apatarpanotha dravyas. Wherever you require, you can adopt stambhana, you can adopt brahmana. Why? Because bruhastu mrudulangayet. Even for when we are doing brahmana, at times we require little bit of langana also. With this, I thank all the organizers. Your program has been so meticulously planned, starting from the reception to the boarding, everything has been very meticulously arranged, and the food also. I thank all the organizers and wish you a very best of luck for the further program. Thank you. Thank you.
Thank you, sir, for your wonderful thought-provoking sessions. Now let us hear from our chairpersons. So I'll call upon Dr. Bunny Gold, sir, to speak a few words. As we are running out of time, I request her to conclude within a minute. Over to you, sir.
Hello. Good afternoon, everyone. You have a very wonderful session with Dr. Srinivas Vadaya. My name is also Srinivas. Ekanamo Sadapri. That's what I'm not praising Dr. Srinivas Vadaya. In fact, I'm his guru, not direct guru, but I took his final year Viva examination. And Viva examiners were myself and Dr. Prasanna Rao. Almost we took 45 minutes for his Viva examination. And during his Viva examination, I as a teacher learned a lot from his answers. And Dr. Srinivas Vadaya is an upcoming Ayurvedic scientist. And I proudly say that he is hope of Ayurveda. He told that it is very easy. He told, no, it is very easy. It is not at all easy for us. Until and unless you dedicate yourself with the study of Samhita in depth and study the commentaries and interpret with the abundant modern knowledge. One lot of gurus are here. Dr. Murthy is there. Dr. Sapsate sir is there. They are talented. So they have well versed in modern medical science, understood the physiopathology of every diseases. For them, Ayurveda, they appreciate the principles of Ayurveda in a better way. So all the young students are here. You know, you in Google and in Instagram, you follow. I always follow Srinivas Vadaya. You also start following Srinivas Vadaya. His best quality is he's a very good Samhita teacher. Many, including me, after completion of post-graduation, many few students aspire for post-graduation to become teacher. He completed his post-graduation in one of the prestigious institutions, that is the National Ayurveda NIA Jaipur. But he didn't opt for teaching. So he's a very good teacher and he teaches the students in his house for Samhita Adhyayana. All of you, anybody interested to become like a very good clinician, just you follow Dr. Srinivas Vadaya. I have been listening to him on various occasions. In every occasion, he is coming out with a very new idea. And the topic which he has chosen is a very challenging topic, that endocrine disorder. You know, treating endocrine disorders from the modern perspective is very easy. Whatever the hormone deficiency is there, you supplement hormone. That's it. That's all. But to treat that particular condition with the interpretation of Ayurvedic principles and what exactly which has been mentioned in the text, apply the same principle and get good results. That's very difficult job, but he made it very easy. And for all young students here, what you have to do is, most important is documentation. You have to do the documentation, which is the modern era. Everybody accepts evidence base. So to have an evidence base, you have to treat the cases. Whatever the cases comes to you, you have a documentation, create an evidence base without compromising with the basic principles of Ayurvedic, clinical, whatever the treatment methodologies that have been mentioned, that we have to follow it. On behalf of all of you, congratulate Srinivas Vadiyar on his wonderful presentation, and he is the inspiration for younger generation. With this, I conclude my remarks, and I extend my gratitude to the organizers for giving me this opportunity to take this particular session. That too, when presenter is my student, and I'm very much proud that Dr. Srinivas Vadiyar will be a role model for all young generation, and he is the hope of Ayurveda. Thank you.
Thank you, sir. Now I request Dr. Sarvesh Varsalaskar to deliver his speech within a minute.
I'll follow your instructions.
Namaste all of you. Happy greetings from Sanjana 2025. Most respected Chair, Dr. Srinivas sir, and the research person, Srinivas Vadiyar, the junior. His father also a great person, senior, and the lone scientist of the dais, upcoming generation for which this platform is really designing, PG and UG scholars, teachers. The message is very clear from this 2 days session. I think yesterday night we were meeting, professors are here. They want to give the responsibility to the next generation. So yes, the generations are ready, and in between the platform research persons starts with Dr. Srinivas today. The message is love Ayurveda. That was the morning also. This he was speaking about that we should love. To know why yoga naturopathy is going straight ahead above the Ayurveda, because they practice. They took the degree and they practice, but we are not doing so. This generation gap is coming. Welcome to the NCIC decision for that delegation, but in the sacrificing Ayurvedic thoughts and principles, we cannot grow. That's the first message. The topic starts with Samhita base. And it is not easy. Generations of UG scholars from different colleges and in India, you are here. You have to have hardship. You have to have hardship. Unless otherwise you are not understanding Sanskrit, not understanding the language, trying to understand what it is said, you will lose the interest. This is the clipages what he has given. It's a hard work from Charak and other parts. He said it's Chakrapani, and he himself is a today Chakrapani of Charak Samhita. So this message, I really congratulate Dr. Srinivas Vadiyar, and also we submit gratitude to your father also, sir, the senior Vadiyar, who has made it possible. You know, the most economical drugs from their home pharmaceutical still it is available. If you get to the any company's medicines, Still, it is the most economical brand they are having for Ayurveda and authenticated medicines. Dr. Gurasa sir is here, who's right. Postal surgery, many times you say, sir. Not only that, many of medicines of your company, the great by this more than 4 decades, Dr. Gurasa sir, please, एक बार ताली लगाइए मोहम्मद फार्मास्यूटिकल के लिए आपको. One thing also, one message for UG, I want to say about it, formulations. Trivon Kirti Rasha, there are 3 bhavanas. One is Tulsi Patra Sorasa, Adrak Sorasa, the third one is Dhokra Patra Sorasa. We won't remember why these 3 bhavanas are given. We only remember Trivon Kirti Rasha, my teacher was writing, I supposed to write, my next student supposed to write. But Tatra Patrasa, if you look into that, against Tavar Vishwa, against Jungle Vishwa, Jungle Vishwa against Tavar Vishwa. So when you get Joro, we have endotoxin exotoxins in the body because of the bacteria. Then again Jungle Vishwa in the body, Tavar Vishwa is going to counteract. So these are the thoughts for integration, sir. Rightly you said, we congratulate, we have this entire fraternity. Dr. Srinivas, keep going. Your channels, many people are already educated. Keep it going, we are proud of you. Thank you. And thank the organizer for giving the opportunity.
Congratulations, doctor.
Sir. Now it's the time to so I call upon Dr. Ashok D. Setpade sir on the dais, retired principal JMC Mysore, to felicitate our resource person. I will also request our chairpersons Dr. Sarveshwar sir and Banipur sir to join me. I request the dignitaries on the dais to hand over the token of gratitude to our chairperson, Dr. Sarveshwar sir and Dr. Banipur sir. I thank everyone from resource person to our chairpersons and organizing committee for giving me an opportunity and all the audience for patient listening. Thank you everyone.
Good afternoon, all dignitaries and delegates. I, Dr. Grishma Menon, Assistant Professor, Department of Shalakya Tantra, JSS AMC, Mysuru, Extend my warm welcome to you all for the second scientific session of Day 1 of Samyojanam 2025. I request our eminent speaker, Vaidya Sri Krishna Sharma Kandel sir, to kindly grace the stage. Let me introduce our eminent resource person for the session today. Vaidya Sri Krishna Sharma Kandel sir is an eminent Ayurvedic physician. Sir is an eminent Ayurvedic physician, researcher, and academician with over 35 years of teaching and clinical experience. A double gold medalist, Sir completed MD and PhD from the University of Rajasthan. Sir has served in leading Ayurvedic institutions, including the National Institute of Ayurveda, Jaipur. Sir has authored 14 books, contributed to the international edition of Charaka Samhita, and published over 77 research papers. A recipient of several national awards, including the Best Teacher Award by All India Institute of Ayurveda in 2018, Best Teacher for Clinical Practice by CCRAs in 2019. Sir currently serves as Chairman IEC, All India Institute of Ayurveda, New Delhi, Chairman SAG CCRAs, and Chief Consultant at Arogya Lakshmi Healthcare Private Limited, Jaipur. Now I welcome Sir for this session. I request Dr. Suryakant Gule Sir, Professor and HOD Department of Rachana Sharira, GAMC Bangalore, to welcome Sir. Thank you, sir. It's my privilege to welcome the chairpersons for the session, Dr. Rajendra V. Sir, retired Professor GAMC Mysore, and Dr. N.V. Krishnamurthy Sir, Principal Maharaj Institute of Ayurveda, Medical Science and Hospital, Mandya. Welcome, sir. I request Dr. Rajesh Sugur Sir, Professor, Department of Panchakarma, GMC Mysuru, to welcome Dr. Rajendra V. Sir. I request Dr. Vijay Mahantesh Hugar Sir, Professor, Panchakarma, GMC Mysuru, to welcome Dr. N.V. Krishnamurthy Sir. Thank you, sir. Theoretical concepts provide foundation to knowledge, while the clinical practice translates this knowledge into real-life healing. On this note, we have the session on the topic, Bridging the Concepts and Clinic in Metabolic Disorders. Over to you, sir.
So we would be attaching the YouTube mic.
Like 1 minute.
अज्ञानतिमिरान्धस्य ज्ञानाञ्जनशलाकया चक्षुरुन्मीलितं येन तस्मै श्रीगुरुवे नमः। सभ्या सद्गुरुवाक्सुधा श्रुतिपरिष्कृतश्रुतिनश्मिवो नालं तोषयितुं पयोदपैषा नाम्भो निधिस्तृप्यति। व्याख्याभासरसप्रकाशनमिदं तस्मिन् यदि प्राप्यते क्वापि क्वापि कणो गुणस्य तदसौ कर्णे क्षणं धीयताम्. Yes. I am the person from Rog Nidan actually, and the central subject of this seminar is digestion and metabolism. Briefly, I will take you into the Prakriti. Prakriti Jnanam Tvarat Vikriti Jnanam. What is our concept behind the digestion and metabolism, which is far ahead from the modern conservative medicines actually. We take all this knowledge from the cosmic universe and we say विसर्गादान विक्षेपै सोम सूर्यानिलस्तथा धारयन्ति जगद्देहं वात पित्त कफास्त्रय. That too in medical sense, not in Vedic or spiritual sense. That every step of our concept is practically practicable. That is useful in Ayurvedic practice. It is useful to rule out the diseases. So what we take, Som, Surya and Anil, these are the three cosmic energies. We are ever anchored with the cosmos. And that energy comes through Prana, Udaka and Anna. Anna contain the Surya and Udak contain the Soma and Anil is Prana. And that too from three Bahirmukh Srotas, Pranavah, Udakavah and Annavah Srotas. Then it goes Adana Karma through, it goes into the digestion and metabolism for Sarira Dravya. There are two different concepts. One is Purus and one is Sarir. Pancha Mahabhut Sariri Samvaya Purusha and those Dhatu Malmulam hi Sariram. Purus is the operator of this Sarir and Sarir is the apparatus. And those Dhatu Mal are operational physiological entities of the body. Okay? How the Som, Surya, Anil converted into the those Dhatu and Mala in three avasthapak. Gross or coarse digestion in avasthapak, Madhur avasthapak, then Amla avasthapak, then Katu avasthapak. Then Agnidhisthana Mannasya Grahanad Grahani Mata. Pakvam srijati parshvata. Pakvam dharayati annam, pakvam srijati, not munchati only. Munchati for srijan. Srijan in dhatu and mala. This is annarasa, which is jnanena rasa dhaturhi vikshep uchita karmana. Then dhatvagni vyapar start. And Dhatvagni Vyapar restructure this Ahara Rasa into the cellular suitability or tissue suitability. And in due course of the iron means upgradation of this energy. Definitely this upgradation will leave the prasad and kitta. When elimination of the kitta will be there, then only the upgradation is possible. So prasad and kitta, then sukshma and sthula, then Sar and Agrim Dhatu, then Mala and Upadhatu. This is the procedure of those dhatu malamulam ki sareeram. In Nishtha Pak, you should have gone through the digestion metabolism of Sri Dwarkanath. He is mentioning about the Anu Pak, Pithar Pak or Pilu Pak. This is the concept from Vaisheshik Darshan, Kannada. Vachaspati Mishra in Vaisheshik Darshan say Anu means Pilu and Pithar is molecule. Duality merged into the unity. This Sarir is to be made finally into the Purusha. This Sarir is Purusha. Sarir is Purusha. After this Sthula Anna will convert into the Sukshma and Sukshma will convert into the Avyakta. This is the journey of digestion. This is the process of the digestion. And final essence of this food is Sattva. अष्टमे मासी ओजः स्थिरं संजायते और अष्टौ साराः. Oj is the life center. तद्धि तत् स्पर्श विज्ञानम धारि यत् हृदयाश्रितम तत्परस्य ओजस स्थानम तत्र चैतन्य संग्रह. The cumulative consciousness of the trillions of the cells are accumulated into the heart, where the par-oja is situated. And Ojasthan is Spandan, Sparsha Vigyan, pulsation. This is the first sign of the life. And absence of the pulsation or Spandan is death. So that our life is Sparsha Vigyan, tactile science. Okay? So this is our digestion metabolism course to the fine and fine to subtle and subtler and subtlest. The subtlest part is Avyakta. Subtlest part is Oja. Subtlest part is Ashtabindvatmak Oja. Ashtabindvatmak is a token amount. Ashtabindvatmak means all the dhatu contribute that Oja with one drop. All the 7 dhatu and 8th sattva will contribute to the par oja, that is Ashtabindvatmak par oja. So this is the science. And what is the Sarir? Sarir, Indriya, Sattva and Atma. These are the 4 ingredients or components of the life. And we are mentioning 4 chapters in Swasthavrta Chatuska. Matra Satiya for taking care of the body, Sarir. Every part of the body should be cared in Matra Satiya. And Tasya Satiya is to be cared for the sensory system, Indriya. Because the Indriya are the extension of the mind and they are exposed to the nature. And they are taking the indriyas from the outside of the body. So, Ritu Sanshodhan is avashyak for the Indriya Shuddhi. So, Indriya Vyapar. Then, Navegan Dharani Adhyay. Navegan Dharani is to make the mana gatiman to each and every part of the body. Whereas Mala will obstruct the gati of mana. Nakh trava malair bina. Where is sensation is not there, where mala is there. So this Navegan Dharani Adhyay for keeping the mana, to the gatiman, to the every part of the body. And last is Indriyopakarmani Adhyaya. That is to nurture the Atma with good practices, with good yam and niyam, vidhi and nishid. This is our science for the digestion and metabolism. But only the digestion not depends on the Agni. In Trividh Kukshi Adhyaya and previous to that, Rasviman Adhyaya, there are Asana Pravichar, Dvadas Asana Pravichar and Ashta Ahara Vidhi Visheshayatan. Why the Ashta Vidhi Visheshayatan? They are to be Satmya. Satmya means one should be homogeneous up to this avyakta. Sarira Satmya, Manas Satmya, Indriya Satmya or Atma Satmya. These are the stages of the upgradation. Srotansi Ayana Mukhani Malaprasadakya Dhatuna. Prasad is not the final substance. Prasad is ever upgrading system. So this is the ayan. Ayan means Nattu Narayana. Okay? Ayan means the final upgradation is in, not in Sattva, but Parahoja. That is Atma, that is Chaitanya, that is the material for the Chaitanya. That is the fuel for the Chaitanya. So this is our digestion metabolism science. This is Anu, this is Anupak, this is Pilupak. And Pitar are these molecules, these all tissues. This is Pitar part. So this is our digestion metabolism. But in next chapter, Matriya api abhyutam patyam channa na jiryati. Agni is good, Matra sevan is good, Patya ahar is good, na jiryati. Because Chinta shoka bhaya krodha dukkha shayya prajagare. In that chapter, Navegan Dharani Adhyaya, some Dharaniya Vega are also there. These Dharaniya Vega also contribute in the digestion. So that's why Dr. Manjunath in morning session, stress, anxiety, this is all factor for the indigestion. Okay? Then this is the process of the digestion. And this digestion process, where this digestion process differs, and what this digestion and metabolism is foundation of the physiology, and the inflammation is the foundation of the pathology. How they convert into the toxins. Abhojanat, जीर्णाति भोजनात्, रुक्ष संदुष्ट भोजनात्, है ना, दुष्यति अग्नि, सदुष्टोन्नम, न तत्पचति लघुवपि, अपच्यमानम, सुक्तत्वम, यात्यन्नम विषरूपता. This गृहिणी, है ना, दुर्बलो विधिहत्यग्नि, है ना, आममेव विमुंचति, है ना, दुर्बला अग्निबला दुष्टा आममेव विमुंचति. If the grihini agni is durbal, grihini is durbal, then it will release the arm. This is the first metabolic pathology. And this arm will create the heterogeneous product, undigestible, unupgradable, uneliminable products. And that will cause of the inflammation. That's why first chapter in Sutristhana, not in Nidanistan. 12 chapters before the Sutristan, they have written Trishoti Adhyay. Means first disease is Sot. Sot means Sudhyamaya Abhakta Krishabalanam क्षारोष्ण तीक्ष्णोष्ण गुरूप सेवा दध्याम ऋक्षाक विरोधि दुष्ट करोप सृष्टान्न निषेवणम च अर्षांश चेष्टा न च देह शुद्धि मर्मोपघाता विषमापशोधि उत्सेद लिंगम स्वयं करोति. This is the samprati of Sot. What is that? After treatment, during the treatment, if the treatment is not proper, Sot is the result of 18 Nidanarthaka Rog. They are mentioned in Trishoti Adhyaya in Sutristan. 18 diseases which are not properly treated. And Sansarjan was not followed. Am dosh was still there. Am langhan, pachan, sedan, kyavagvu, tiktaraks are not seven. So am rasa is still there. That will cause the Sot, amaj Sot. Because the roga ahara sambhava. And rog ahara sambhava means roga sarvepi mandekno. And what is the Agni? Ayuru, Varano, Balam, Swasthyam, Utsaho, Upachaya, Prabha. Ojas, Tejo, Agnaya, Prana, Shokta, Dehagni, Hetuka. Sante Agno, Mriyate, and if Agni is Saman, Vita Roga Shama Shatam. If Agni is good, then no disease, no chance of the disease. Because Agni is a Satmikaran. Agni for Satmikaran. So, why the Asan Pravichar after this Ashtau Ahar Vidhi Visheshayatan? Ahar Visheshayatan is for Satme and Asan Pravichar is for Sadgunde. For attaining the maximum ultimate properties of the food. This is the Sadgunne. Asadgunne or Sadgunne. These are the two words mentioned in the Rasviman. One is Am. Amo Visham Chikitsyanam. Amo Visham Chikitsyanam. This is written in Yajapurshi Adhyaya. Am Visham Achikitsya or Visham Chikitsya. It is very difficult to treat. And this creates the havoc of the inflammation. This creates the sequence of the inflammatory process. This is the normal process, Phen Bhut Kaf, Achha Pitta and Katubhav Vayu. If this Phen Bhut Kaf is converted into the Avil, Pitchil, Guru, Mand, Seet, Stambhit, then it will create the Ama. Then Achha Pitta is not Achha, that is Vidahi, or Sukha, then it will create the Paka. And if the Katubhav Vayu is not Katubhav, Katu means Pramati, Vyavahi, Vikasi, or Vikshepan. If Vayu is not Katubhav, Katu is not the guna of Vayu. Katu is not the rasa of Vayu. Ruksha, Shito, Lagu, Sukshma, Chalota, Vishada, Khara, Vayu is not Katu. But Katu Bhav for Vikshep, Uchit Vikshep. But Katu Bhav Vayu, if this Tikta Vayu or Kashaya Vayu, that is Tamman. So that Vikshep will not Uchit Vikshep. Tikta Bhav, then Druta Vikshep. Druta Vikshep means Sakhat, Akoshtha, Sakha, Malayanti, Drutatvan Marutasya. Accelerated propulsion. If the Katu Bhav is Uchit Vikshep only. This process Kapha in Ama, Pitta in Supta, and Vata in Vistabdha or Amavisha. And sorry. Oh, please. What is full page? Full page. Okay. Then this is the Koshtagat arm. Koshtagat arm will create only three situations: Ajirna, Vishuchika, and Alasak. This is written in Vimanasthan 2. But if the ama is propelled or thrown out from the grihani of Durbalo, amameva vimunchati, then sansrijyamanam pittena daham trishna mukhamaya. Yakshma pinas mehadin kapajan kapasangatam. Karoti vata sansrishtam vatajansya gadan bahu. Mutra rogan mutrastam sakrit rogan sakritgatam. Rasadi vishya sansrishtam kuryad rogan rasadija. If this arm is thrown out from the grihani, alpata of Agni or grihani, durbalta of grihani, then it will associate with dosha or dhatu or mala or indriya or updhatu and will create the specific diseases. Vishtamba, Sadanam, Sirsoruk, Murcha, Brahma, Prashta Katigraha, Drimbha, Angamarda, Trishna, Jwara, Chardi, Pravanam. This Amavisha will obstructed at the place of Khayvegunya. Yadetat srotansi prakriti bhutatva na vikari rupsarjite sariram. If the dosha are there, prakupit dosha are there, Amavisha is also there, but if the srotas are normal, srotas are physiological, there is no question of the disease. If the srotas is dushta, why srotas is dushta? Khayvegunya is there. Khayvegunya means the site for the sthan sansray. And Khayvegunya is with very different causes. From genetic causes, from viruddhahar, from abhyas, adhyasana, samasana, adirna bhojana, and vishvasana, and dhatukshaya also. So Khayvegunya has many systems, many causes. So Khayvegunya is a different position. If the Khayvegunya is there, the arm will stay there. This arm wish is injurious to the cell, injurious to the tissue. This is the first injury manifest as sore, inflammation. First injury will manifest in sore, Ahmad sore. Then an inflammatory response is reaction to the cell injury. Cells are acquainted with the good prasad dhatu, poshak dhatu. But if the arm wish is there, they are injured. and this injury will spread out into the tissue and tissue into the organ, okay, and organ into the system. Sushruta says there are three vasculatory monitors. सह शब्द अर्ची सह रसः शब्द अर्ची जल संतानवद अणुना विशेषेण प्रधावत्येव केवले शरीर. And Charak says the manat damanya, sarnat sira, and sravanat srotat. Daman is shabd. Sravan is parinam apadyaman dhatunam is archi santan. And saran is jala saran, jala santaran. It is jala santan, archi santan, and shabda santan. There are three types of the srotas. Dhamani, Sira, and Srotas. And this monitoring system of the vascular system is, if they male, then Dhamani, Sira, and Srotas, all the three will be impaired. Ayan, Sravan, and Parinaman. Dhamani, hemodynamic changes, vessels, valses, Sravan, and Parinaman. Parinam apadyaman dhatunam abhivahini bhavanti ayinarthina. This is Srotas, the three functions of the Srotas. And these are the cardinal symptoms of the Sot in modern science. And these are the in Ayurveda. Ushma Davatu Siranam Ayama Sagoravam Anavastitam Siratanutvam Utsed Lomaharsa and Anga Vivarnata. These are the Ayurvedic Purva Roop of the Sot. Very clear. This is the stage of the Sot, Purva Roop of the Sot. First, they infiltrate into the dhatu, then in upadhatu, and in sara also, and the mala also. Then in second level of the energy system is a sensory system that will also affected with this amavish. Indriya pradoshas vikar. That's why in Vividashit Pitiya, Indriya pradoshas vikar also mentioned. Okay. This amavish, this Trishothi Adhyay, then further advances in Soth Chikitsa, then further advances in Trimarmiya Chikitsa, and then Trimarmiya Siddhi. Three vital organs. Soth in general with Agantuk and Nijkaran and local. And general Soth is Soth Chikitsa Adhyay. And vital organs are affected in Trimarmiya. And vital and most vital 107 marma in Trimarmiya Siddhi. This is 4 chapters on the Sot are mentioned in Charak Samhita. These are the Kapha Sot, these are the Pitta Sot, and these are the Vata Sot, and Rohini is Tridosha Sot. These are local. Then it spread out into the generalized Sot, and then Alasak, Pandu, Jwara, and then secondary inflammation, then Marmopghat. Then catarrhal inflammation, fibrinous inflammation, serous inflammation, pseudomembranous inflammation, gangrenous inflammation, suppurated inflammation, ulceration, and chronic inflammation, and systemic effect of the inflammation is fever. These are the progressive stages of the Sot. And Ayurvedic perspective of the fever. ये आप सब जानते हैं. This is Sama Vata's inflammation. This is Sama Pitta's inflammation. This is Sam Kaphaj inflammation, and these are the differential diagnosis of the inflammation. What is Pitic Sot, what is Vatic Sot, and what is Kaphaj Sot. And what is the gender-wise prognosis? Stri and Purush. Stri Mukhacha and Purush Padacha. And there are Indriya Sthan, near-death symptoms of the Sot and complications of the Sot. And this is the pathogenesis of the inflammation. Second level, 3 vital organs, heart, kidney, and brain. And these are the 6 phases, Sanchay, Prakop, Prasar, Sthan, Sansay, and Vyakti, and Bhed. And this is all. Thank you. Sorry, the question was very long, but arm will convert into the Sot. And Sot in this way. Thank you very much.
Thank you, sir, for the knowledge-filled session. Now I request the chairperson for the session, Dr. Rajesh Reddy, sir, to share his valuable thoughts.
I'll keep it very brief and precise. I understand the pain of organization. Well, not much. I feel I am honored to be here today to share a wonderful session by a very senior clinician, come researcher, come academician, and not much to say, especially when the presenter is a senior person with respect to the age, knowledge, experience, and everything. It's very difficult for a chairperson to pass any critical comment. The only comment that I can pass at this juncture is that he needed more time. Probably he could only, he was just he was planning for a foundation for what he wanted to talk in the next few slides, and I think that was the most important part of his presentation. But as we understand it, as it always happens in conferences, there will be other factors apart from the academic and other issues. The time management is a very big issue. So understanding the problems and the pains of the organizers, I don't take much time. It was a very good session. Thank you all. That's it.
Thank you, sir. Now I request our chairperson, Dr. Rainvi Krishnamurthy, sir, to share his valuable opinion.
Respected most senior physician, Vaidya Shri Krishna Sharmaji. His narration was very good regarding the metabolism. He explained about Soma, Surya, Tata, Nilaha. See, the macro and micro, whatever it is present in the universe, same thing it is in the micro universe. This is all Panchamahabhuta theory. Those who follows this, especially in Vagbhata Samhita, what they told, he highlighted it. Hitabuk, Mitabuk, and Kshutabuk. That will be the best to maintain the normal metabolism. And also he highlighted the consciousness. Consciousness is very, very important to eat. So once if you follow that one, probably these metabolic disorders from the beginning we can control. Very, very thankful to you, sir. Thanks for the organizers. Thank you.
Thank you, sir. Now it's time to felicitate Vaidya Shri Krishna Sharma Khandian, sir. It's my privilege to welcome Dr. Prasanna N. Rao, sir, Director, SDM Institutes of Ayurveda, and Dr. Shailaja Umam, Principal, SDM College of Ayurveda, Hassan, to do the honors. Welcome, sir. Welcome, ma'am. I also request our esteemed chairpersons to join the felicitation. I request Dr. Santosh Kumar Bhatt to come on the stage, please. Thank you, sir. Now I request the dignitaries to felicitate Dr. Rajendra Reddy, sir.
ಓಡಾಡ್ಕೊಂಡು ಮಾಡ್ತಾರಾ ಅಥವಾ ಹಾಗೇನಾ ಸ್ಟ್ಯಾಂಡಿಂಗ್ ಅಥವಾ ಇಲ್ಲೇ ಸ್ಟ್ಯಾಂಡ್ ಮಾಡ್ತಾರಾ ಅಂದ್ರೆ ವಾಕ್
Now it's time to felicitate our elder chairperson, Dr. L.K. Krishnamurthy, sir.
ಅಲ್ಲಿ ಅಲ್ಲಿ ನೋಡ್ ಮಾಡ್ತೀರಾ ಅಲ್ಲಿ ನೋಡ್ಕೊಂಡು ಮಾಡ್ತೀರಾ
Thank you, sir. Thus we come to the end of the session too. I wholeheartedly thank our resource person and both the chairperson for the session. Once again, I'm grateful for the opportunity. Thank you. We'll proceed with the session 3 now.
This one is for you and this is for you.
Okay. Means both are functional.
Yeah.
And both are to be used. This one. Front.
Front and back, and this is for laser.
There is an announcement for all the paper presenters here. All the paper presenters, please assemble at Kaveri Hall, the venue Kaveri Hall for paper presentation by 4:55 p.m. Kaveri Hall, paper presentation venue. Om Dhanvatare Namaha. In keeping keeping with the spirit of our ongoing scientific deliberation in Ayurveda at Symposium 2025, I would like to call upon Dr. Santosh Kumar Bhatat sir for our next session. It's my honor to extend a warm welcome and introduce our esteemed speaker, Dr. Santosh Kumar Bhatat, an eminent scholar, clinician, researcher, and academic leader to the field of Panchakarma and Ayurveda. Dr. Santosh Kumar Bhatat sir is currently serving as Professor and Dean at All India Institute of Ayurveda, New Delhi. And sir has mentored around 50 MD scholars and 10 PhD scholars. His contributions have been widely recognized with prestigious honors, with prestigious Panchakarma Physician Award, Zandu Vishishta Chikitsak Samman Award, and many more. He has also contributed to the WHO review meetings on benchmark documents for Ayurveda and assisted in drafting the Zero Draft for Panchakarma standards. A respected expert for multiple universities, commissions, and national bodies such as RAB, NCISM, CCRAs. Sir continues to inspire the whole Ayurveda fraternity. Now I would like to call upon Dr. Champapan, Professor and HOD, Department of Kaumara Vidya, Sushrita Ayurvedic Medical College, to welcome our speaker with token of respect.
Namaste, madam. Thank you.
Thank you, Dr. Champapan. Now I would like to call upon Dr. Aruna Mangalji ma'am, retired principal, Government Ayurvedic Medical College, Mysore. I would like to call upon on the stage, to the stage. Ma'am has served as HOD in the Department of Fire Chikitsa, postgraduate Department of Fire Chikitsa. Ma'am has guided more than 25 to 30 PG scholars and has authored a very renowned book, Essentials of Fire Chikitsa. She has worked as member of Board of Examiners RGHS Bangalore and also worked as a member of UPSC Selection Committee. We welcome you, ma'am, as chairperson for the session. I would like to call upon Dr. Mamta Bhagwat ma'am, Professor and HOD, RVS Ayurveda Medical College, Bengaluru, to welcome ma'am. Thank you, Dr. Mamta ma'am. Now I would like to call upon our next chairperson, co-chairperson, Dr. Rupa Bhatt ma'am, to co-chair the session. Dr. Rupa Bhatt ma'am, please welcome to the stage. Dr. Rupa Bhatt ma'am serves as principal at Dhanvantri Ayurvedic Medical College, Siddharpura. Madam has completed her PG studies in Kai Chikitsa from GMC Mysore. Madam has guided more than 14 PG scholars, delivered over 15 public health awareness talks on Ayurveda, and she is the coordinator of Mahila Prakoshtha for Southern Zone at Vishwa Ayurveda Parishad. I request Dr. Ravi Rao, Principal, TP Savani Ayurvedic Medical College, Surat, to welcome ma'am. Thank you, sir. Now I request our speaker to take the session forward. Over to you, sir. Thank you.
Namaste. At the outset, I would like to thank the organizers for being invited for me to share my little clinical experience in the management of dyslipidemia. Friends, why this topic is so important? If I'm not wrong, 1 among 4 in the audience, though you are the young people, but if you go for your lab investigation, definitely today or tomorrow at some point of time, you will come across this particular condition. What the data says is, at least 1 among 4 person is suffering with some sort of dyslipidemia. So this made a sense that how much it is important to work on this particular clinical condition or a pathological condition, dyslipidemia. If I say it is a silent killer, so I'm not wrong. Many of the consequences of this particular clinical condition or pathological condition, they are life-threatening. And one of the commonest outcome of this is the atherosclerosis that we all know. If we look into the modern management of this, it is all only the statin and statin. Now the other drugs, fibrates and other things, they have came up, but everything is having its own limitations with lot of adverse effects. So definitely from Ayurveda, can we provide a significant relief which is safe and long lasting? That was a point which came to my mind around 15 years back. Then I started a series of work which can generate some evidence in the management of dyslipidemia. Friends, I would like to know what could be a Ayurvedic coin or Ayurvedic term to coin this dyslipidemia. Can anybody from the audience? What precise term we have for this dyslipidemia? Have you heard the term Medo dosha, which I have mentioned in the slide? Medo dosha. We all heard about the Medo roga. We all heard about this Sthaulya. We all heard about the Atisthhaulya. But this typical term Medo dosha is for the first time coined by Acharya Sharangdhara. This is the only one slide I'll be talking on Ayurveda. Rest of the things are all on the management aspect. So Sharangdhara has distinctly, he has classified the 2 pathological consequences of Medo roga. One is Sthaulya and Medo dosha. So I'll be talking more about the Medo dosha, which directly goes parallel to that, the description of dyslipidemia. With this background, I'll proceed further. So as I told, why this is so important to work on this particular condition, the graveness of the pathology and its consequences. There are limitations in the conventional medicine, and the most important is higher incidence and prevalence. As I told, at least 1 among the 4 person, the latest report says that 1 among the 3 person are suffering with the dyslipidemia, which is a silent killer. So in the morning also we had a very good, very informative talk from the most respected person in the field of cardiology, Dr. Manjunath sir. He was also telling that how much this hypercholesterolemia is dangerous. And the most quoted study in this is a Framingham study, which says that the hypercholesterolemia or dyslipidemia is directly proportional to the coronary heart disease. And coronary heart disease is a leading cause for the mortality. So this study suggests that every 1% increase in the cholesterol level, there is 1 to 2% increase in the incidence of coronary heart disease. How much it is important to have a measurement on this? You just look into 1% increase in the cholesterol will have equivalent, almost 1 to 2% increase in the coronary heart risk. So that much it is important to take care of it. This Framingham study suggests that almost the coronary heart disease causing more than 25% of the deaths. And it has been predicted that India will host more than half the cases of heart disease in the world within next 15 years. So this is the latest report. You look into the prevalence. 28% is having hypertriglyceridemia, 24% is hypercholesterolemia, 38% is having low HDL. In the earlier presentation, my friend Dr. Vadeyer was telling that triglyceride to HDL ratio is the latest trend that is very important. We all know that HDL is very important for the prevention of coronary artery disease. So the HDL, low HDL is coming around 38% and 18.9% is the high LDL. So this is the latest report indicating the prevalence, which almost says that at least 1 in 3 or if not 1 in 4 person is suffering with this particular pathological event, dyslipidemia. The Indian study, that is ICMR, the apex body in the clinical medical research, that suggests that particularly the states like Kerala, Goa and West Bengal have the higher incidence of dyslipidemia. There is another condition called as a familial combined hyperlipidemia, is estimated at 1 in 100. So there are two different terms are used. One is a dyslipidemia, another is a hyperlipidemia. Almost same, but dyslipidemia is, there are 4 different components. The raised cholesterol, raised triglyceride, raised LDL, VLDL and reduced HDL, that refers to the dyslipidemia. And there is a hyperlipidemia, which particularly refers to the increased level. So now I just simply, to my student, I say one formula they have to remember when they are managing the dyslipidemia. The desired level of lipids in a healthy individual, just one formula: 50, 100, 150, 200. 50 is the desired level for HDL, 100 is the desired level for LDL, 150 is the desired level for triglyceride, and 200 is the desired level for cholesterol. It should be below than this. So just I am going a little bit fast because the organizers are running short of time. So there are 2 kinds of dyslipidemia. One is a primary dyslipidemia and another is a secondary dyslipidemia. Primary dyslipidemia is basically because of the gene mutation, and secondary dyslipidemia, which is very common, and both of them they are described in Ayurveda. If you remember, just without going into the much details of the Ayurveda concept, we all know that if you remember the prameha, which is described as a medo pradoshaja vikara, and since morning we are hearing that metabolic syndrome, a big term, which includes dyslipidemia, diabetes, hypertension, obesity together. So all these are being described in the same context in Ayurveda. And this prameha is also described as sahaja and a jatottara. And similarly, the atistholya, which is described in the Ashtoninditiya, that is again indicative of the genetic cause for this. Similar way, in the modern medicine also, they suggest that primary dyslipidemia is mainly because of genetic mutation. The secondary dyslipidemia, which I was talking about, the medo dosha, there also Sharangdhara very specifically says that it is because of the avarana in the marga, in the srotas. And here also the factors for that is the lifestyle factors and the medical conditions. And if you look into the risk factors, mainly physical inactivity, unhealthy nutrition, obesity, diabetes, all those factors we are hearing from the morning, they are all contributing to the development of dyslipidemia. So this is the cascade of reaction, what actually happens once there is a dyslipidemia, how the vicious cycle continues. So first there is an inflammation, then there is accumulation of this triglyceride, LDL particularly, and then ultimately the last stage is the damage to the endothelium of the vessel wall, and the other side is the atherosclerosis, which subsequently result to the many complications. So this is the clinical presentation of dyslipidemia, because from the Ayurveda point of view, sometimes if we won't go to the investigation, but by looking at the patient also, the one of the common is xanthoma. Some of us, if we are lucky, may not have, but it is very common. There is a yellowish fat deposition on the eyelid, sometime on the skin. There is a very common presentation of the dyslipidemia. Arcus senilis, that is a gray white ring around the cornea. Lipoemia retinalis, which is a milky appearance in the retinal vessels. Lower limb ischemia. Nowadays, these peripheral vascular disorders are becoming very common, and that is sometimes the patient comes with this particular darkness of the lower limb and discoloration, and then we will come to know that is because of the atherosclerosis subsequent to the dyslipidemia. Then angina. Now, as many times the younger population, in the morning also we heard from this Professor Dr. Manjunath ji, and this angina is mainly because of the atherosclerosis in the coronary arteries. And nowadays it is very common as early as 40 years also. And transient ischemic attack or the cerebrovascular accident. These are the consequences of dyslipidemia, which are very life-threatening complications are there. That makes a sense that if we can prevent this dyslipidemia by following Ayurveda lifestyle or the Ayurveda code of conduct, and what precaution we have to take. So all these things I'll be talking in the subsequent slide. Just now, I am just covering the basic of the dyslipidemia. These are the severe consequences or life-threatening consequences of the dyslipidemia. Atherosclerosis, ischemic heart disease, cerebrovascular accident, peripheral vascular disorder, renal disease, and metabolic syndrome. All these diseases are very life-threatening, and sometimes definitely they'll end up into emergency. So this is how Ayurveda distinguishes two different clinical conditions of the Medo Roga. In the just previous presentation, Dr. Vader was telling that we have a Santarpanotta, we have a Apatarpanotta. The same concept goes here also. So in the Medo Roga also, the dyslipidemia is not very common in the obese people only. Nowadays, it is commonly seen in the lean and thin constitute people also. So the same was observation from the modern side also. Earlier, it was thought that only obese people will have dyslipidemia, but in clinical experience, the lean and thin people also present with the dyslipidemia. So that is very specifically Acharya Sharangdhar has differentiated that Medo Roga into two clinical presentation. One is a Sthaulya, that is adiposity, which is very much close to the obesity, and the second is a Medo Dosha or the lipid disorders, basically causing obstruction of channels and leading to coronary or cerebral insufficiency. So I am talking this about the second condition. Now, so far we discussed about the etiology, pathology, and consequences. Now, how to frame the line of treatment? So we have three kinds of line of treatment, as we all know that Nidana Parivarjan is there, Samshodhana is there, Samshamana is there. So we don't have a direct description how to manage the dyslipidemia, but understanding from the Ayurveda as a Medo Dosha, as a part of Medo Roga, then we have to understand the pathology. So there are three aspects. One is the Prameya Samprapti, another is the Sthaulya Samprapti, and the Medo Dosha Samprapti. So the first is the Sankshepta Kriya Yogo Nidana Parivarjanam. That concept we have to adopt for the prevention and for the precaution also. So the sum of the parameters, some of the treatment guidelines from the Nidana Parivarjana. And then, as I told, Prameha, the Samprapti of the Prameha is from the Medo Vaha Sroto Dushti. And that's why we have to adopt the Chikitsa which is described for the Sthula Pramehi Balavan Yayaka, that was also discussed in the previous presentation. Samshodhanam is the first line of treatment. And then second is the Samshamana, and particularly Medo Dosha. The opposite is we have to go for the Lekhana and the Rukshana. So these are the three different things which I tried in last 15 years study. I'll be presenting those things. So among the Samshodhana, three treatments commonly: Vamana, Virechana, and Vasti Karma, and Rukshana, particularly the Rukshaniya Dravya and Rukshaniya Ahara. So whatever I am presenting here, all these are the published work in the peer review high impact journals, and they are being conducted after going through the institutional IRB, IEC, and the CTRI registration only. One of the study was conducted by Dr. Pooja B.A. She is presently working as Associate Professor at Sushruta Ayurveda College during her PhD study. So the important thing is, how many of you have practiced Vamana Karma with different drugs? Generally, we practice Vamana Karma with Madan Phala. Have you practiced Vamana Karma with Dhamargava, Vamana Karma with Vatsaka, Vamana Karma with Kritavedana, Vamana Karma with Ikshvaku, Vamana Karma with Jimutaka? How many of you have practiced? That's good. So for the first time in 2007, I started working on different formulations, because in Charaka Kalpasthana, 12 chapters are dedicated for different formulations, but none of the studies were conducted. So after searching all these things, these particular yogas are described for a particular clinical condition. So considering this dyslipidemia as a Medoja condition, which is very parallel to the Kaphaja condition, I searched, then I got Dhamargava is one drug which is indicated for this particular kind of condition, and Vatsaka is another drug which is indicated for the Rudroga. the ultimate complication of dyslipidemia is the Rudroga. So considering this factor, I started working on the Dhamargava Kalpa for Vamana Karma in the dyslipidemia and Vatsaka Kalpa for Vamana Karma in the dyslipidemia. Similarly, I also worked on the Ikshwaku along with using different Kashayas. We have Madhu, Kovidar, 9 Kashaya Kalpas are there. Among that, Kovidar Kashaya is specifically used. So I'll be talking all those things. So this is the Dhamargava. Dhamargava is nothing but now Tuppada Hirekai ಹೇಳ್ತೇವಲ್ಲ, wild variety of the Tuppada Hirekai. So this is for the first time getting this Tuppada Hirekai is or the Dhamargava is difficult. So this Dhamarga Phala was used for the Vamana Karma in the patients of dyslipidemia, and you can see the result. This study was conducted at NI Jaipur when I was professor and head there. So you can see the results. The serum triglyceride, there is almost 28% reduction. Even the serum cholesterol was also reduced by 15%. The VLDL was reduced by 26% when we use the Dhamargava Kalpa for the Vamana Karma. This is the whole study is available. This is published in the Arya Vaidyan. The interested people, you can refer this particular work. This is with respect to Vatsaka Bija. Vatsaka is a Indrayava which is indicated for the Rudroga. So that first time we used the working on the Vatsaka Bija, and you can see that serum triglyceride was reduced by 32%, and it is very safe. I tell you, among the 6 Vamaka Dravyas, Vatsaka or the Indrayava Bija for Vamana Karma is very safe, very comfortable, patient will do. Only the Vegas will be a little bit mild in comparison to Kruta Vedana also I worked, where the Vegas will be more projectile. But Vatsaka is very useful for the management of dyslipidemia. Apart from triglycerides, there was significant reduction in the cholesterol, which was reduced by almost 15%, and the VLDL was 12%. This VLDL by 34%, and the LDL was about 13%. So this study is published in Journal of Ayurveda. Interested people, you can refer this work also. This is the Vatsaka Bija. This is another study where I did a combination of Madan Phala and Vatsaka along with the Kovidar Kashaya. This study was conducted at All India Institute of Ayurveda, Delhi, and the outcome you can refer in the last. It was very significant reduction in the total cholesterol, triglyceride, LDL and LDL-HDL ratio. This is a series of patients of dyslipidemia. We are conducting Vamana Karma at All India Institute, Delhi. This is another study on the Ikshwaku Kalpa, particularly on the pre-diabetes management. So this is also parallel to that of dyslipidemia. All these conditions goes together. Pre-diabetes in the morning also we were hearing dyslipidemia, pre-diabetes, obesity, diabetes and metabolic syndrome. So there also a series of patients with the pre-diabetes. I was conducting this Vamana Karma with Ikshwaku Kalpa with a very good clinical outcome. So this is the projectile Vamana Vegas. So in this way, by using specific kalpas for Vamana Karma in the patients of dyslipidemia, there is significant reduction in the triglyceride, in the cholesterol, in the LDL. Then second study I was talking which about Dr. Pooja B. This study was conducted by Pooja while she was doing PhD under my guidance. This is a very good clinical study, standard controlled clinical study, and all these studies are also published both in Asian Journal of Cardiology and in Ayurveda Journal. So the modern part was published in the Asian Journal of Cardiology. So this study was conducted in association with the Savai Mansingh Medical College, Jaipur. So there were 3 groups. In one group, classical Shastriya Virechana Karma. The important thing is here the Trifaladi Taila was used for the Snehapana. The Lekhan Basti, Sushruta's Lekhan Basti was given in the Kala Basti modified schedule. Modified schedule in the sense there is 3 Niruha and 1 Anuhasana, like that modified schedule. And then the third is a standard control atorvastatin. So the important thing is very significant improvement was seen in both the group Virechana and Lekhana Basti. Lekhana Basti was very much effective in the reduction of particularly the serum cholesterol. You can see that from 267 to it came to 167, and the important thing is the effect was maintained even after the follow-up. So that is the very important outcome of this particular study. And though Virechana was also effective in reducing the cholesterol, but Lekhan Basti was much more effective in comparison to Virechana and atorvastatin. This is with respect to triglyceride. You can see that Virechana was highly effective in reducing the triglycerides. The level from 256 to it came to 152, and which was maintained even after the follow-up. And the result was highly significant. Though Lekhan Basti also reduced the cholesterol from 218 to 166, which was also again significant. So from this study, what is important is when the patients were given atorvastatin, their HDL cholesterol is going down, coming down. But those patients who were managed by the Virechana karma, you see that their HDL cholesterol was increasing even after the follow-up. The most important take-home message from this talk is the Virechana is not only useful to reduce the bad cholesterol, but at the same time it helps to improve the good cholesterol, which is a very important for the prevention of coronary events. In atorvastatin, you can see there was a reduction in the HDL after the treatment. This is a LDL, bad cholesterol. The Lekhan Basti has shown very significant improvement, which was reduced from 167 to 77, which was again statistically significant. So the group A Virechana has shown very good improvement in the VLDL from 51 to reduced to 30, which was again statistically significant. So final message from this particular clinical study is Virechana is the best treatment for the reduction of triglyceride and for the increase in the HDL, whereas Lekhan Basti is the best treatment for the reduction in the cholesterol. You can see that the Virechana karma, there was reduction by 40% in the triglyceride. So those patients who are with the hypertriglyceridemia, we should give them the Virechana karma with the Trifaladi Thaila Snehapana. The Lekhan Basti is very effective in comparison to triglycerides. It is more effective for the reduction of the cholesterol. So in the patients with the hypercholesterolemia, you prefer Lekhan Basti. The patients with the hypertriglyceridemia, you prefer with the Virechana karma. You see this atorvastatin, there was reduction in the HDL in comparison to Virechana and Basti. Hence, this study proves that Virechana and Basti both are much better in comparison to the standard control. So the final outcome of this is Virechana karma is highly effective for the reduction of triglycerides, and Lekhan Basti is highly effective for the reduction of cholesterol. This study is published in one of the peer-reviewed journal, Ayu from Jamnagar. You can refer for the details. This is a meta-analysis of 7 different studies. Apart from this Virechana and Basti, the other studies which were conducted, and this is published in the Journal of Alternative and Complementary Medicine. The meta-analysis by taking the different data of different studies. So here you can see that the first slide where the Vamana Karma, Haridra Dvaya Churna, Triphala decoction, Basti with Triphala decoction, Yavadi Roti, Pathya, Pathya Kalpana and Musta. 7 different clinical studies were conducted. And the important thing from this slide is, again, from the Ayurvedic parameters, if you look into, there are 4 basic parameters we have taken here. The mean age is below 50 years. Some of the age patients are below 40 years. So that is very important. In that productive age, people are suffering with the dyslipidemia, and ultimate consequence is the myocardial infarction or the coronary artery disease. The percentage of male is much more higher, and then the percentage of vegetarian diet is very low, and then the Krura Costa patients are almost 40% to 50%. So this is something from the Ayurveda point of view, we can guide these people how they can modify their diet. This you can see when Vamana Karma with Madan Phala is done, there was a reduction of almost 16% in the total cholesterol. The triglycerides were reduced by 14%. HDL was increased, as in the Virechana also there was increase in the HDL after the treatment. After the Sansarjan Karma in Vamana Karma with Madan Phala, there was increase in the HDL level. The LDL and VLDL were reduced. Simple Triphala decoction has shown a very significant improvement. There was reduction by 16% in the cholesterol. Triglyceride was reduced by 21%. HDL, there was a significant improvement. What is more important, you can see in this study, even the Yava Ahara along with the yoga guideline, that has shown almost 44% decline in the dyslipidemia index. Though the Vamana has shown 77% decline, Triphala decoction 75%, But the most important and promising drug from this meta-analysis is the mustachuran. Mustachuran, you can see that there was a 94.7% improvement in the dyslipidemia index. And if you see, there is a 30% reduction in the cholesterol, 47% reduction in the triglyceride, and there is a significant improvement in the HDL and significant reduction in the LDL. So this is again the continuation of the meta-analysis. Percentage-wise reduction, if you look into the Vamana Karma, particularly in the cholesterol, there was significant reduction in the percentage from 66 to 20, triglyceride from 66 to 53, and the mean reduction, if you look into the last dyslipidemia index, which was average 60% in the dyslipidemia index, and it came to 13.3. And the last two, Triphala decoction from 85.7% to 21.4, and the most important is in the group of Mustachurna. They are all different 7 clinical studies. From 63%, it came to 3.3%. So from this study, this is published in one of the very high impact journal, Current Researches in Complementary and Alternative Medicine. So this Vamana Karma, to conclude today's talk, particularly from the Panchakarma point of view, Vamana, Virechana and Basti are highly effective in the management of dyslipidemia. The probable reasons for this is Vamana Karma is best to eliminate the vitiated Kapha dosha. Particularly, the core concept of Ayurveda says the Kapha dosha is a Bahudrava Shleshma, which is described in the Samprapti of the Prameha. And that is the same way, I will not go into much of the conceptual understanding when the Shodhana is indicated, the Samvata Rupa Vruddhishchaya, Vilayan Rupa Vruddhikopa, that all kind of description we have from the Sushruta Dallana's Tika. So here also, this particular Vamana Karma helps for the elimination of the Bahudrava Shleshma. Indirectly, it reduces the Bahu Abadda Meda, that is nothing but a circulating lipids. The Virechana Karma, which is best for the correction of Pitta dosha, and ultimately, if you look into the Phala of the Virechana, Ojo Agnir, Dipto Agnir Anamayatvam. So this is how the important thing is in the regulation of the lipids, production, excretion. So this Virechana Karma helps for the correction of Agni and particularly the liver metabolism and the intestinal functions. And Basti Karma, one possible hypothesis I have suggested here, if you look into the Samprapti of the Medo Roga, somewhere the Vata is playing a significant role for the progress of the disease. So this Basti for the regulation of Vata, thereby it may be regulating the function of acetyl coenzyme A reductase, which is very much important in the hypercholesterolemia. So this way, this Vamana, Virechana and Basti is effective in the management of dyslipidemia. Coming to the Shamana and Nidana Parivarjana, particularly this Musta Churna, Haridra Dvaya and Triphala decoction are found to be effective in the studies which were conducted under my guidance, and the Ahara, particularly the Yavadi Roti. So just to conclude, by using specific drugs for the Vamana Karma, Virechana Karma, Snehapana and using specific Basti, we can provide a significant relief to the patients of dyslipidemia. Panchakarma procedures, they modulate the immune response, inflammatory process, liver and intestinal functions, and do have a positive effect on the gut microbiome and the gut dysbiosis. Now in majority of the lifestyle diseases, there are other 2 studies which I am working on the gut microbiome with respect to diabetes. One is on Vamana Karma, another is on the Basti Karma. So there is an initial outcome is they are regulating the gut microbiome also. So they may overcome the gut dysbiosis, in turn help in treating many lifestyle diseases. Drugs like Musta, Haridra, Daru Haridra and Triphala, which are Rukshani in nature, are effective in dyslipidemia, and particularly the Yoga Abhyas and the Ayurvedic Ahara. If we advise the patient, definitely we can prevent, we can check the progress of the disease. So with this, I would like to thank the organizers for giving me this opportunity to share my little clinical experience of last 15 years. This today's talk, I will dedicate to my beloved teacher, Professor M. Ishwareddy sir. It is all because of my teachers. Professor Anjani Murthy sir is here, Professor Bannigol sir is there, Professor Satpute sir is there, my senior teachers, Sri Krishna Khandel sir, my friend Ravi Rao, and all to my mentors, seniors, and my teachers. I will dedicate this talk to all of you. Thank you.
Manjuji ma'am to deliver insights on the session.
And Dr. Santosh Kumar Mate and students. It's a wonderful presentation, I can say, because I too have worked in that department, in that particular subject, so I could enjoy this, what work he has done. And I congratulate him on this occasion, that his work is really appreciable very much, and it can be practiced. His work on Medo dosha he has mentioned. He has mentioned about the Medo dosha. Meda itself is a fat. Fat deposited on the body is Meda. But what about this lipids? So he correlated lipids with the Medo dosha. I have a different opinion, maybe not correct or maybe correct. That you can judge, or some time will come to judge that. Vasa sakala shariram sneha. Vasa is, you should not misunderstand, but what I have studied, because Vasa is the lipids present in the blood, and which is visible fat deposited on the body is Meda. So primary dyslipidemia and secondary. In Charaka only, Charaka Sutra, 21st chapter, that is Sahaja, that is from the parents it comes, it has mentioned in Charaka also. So Charaka Sutra, 21st chapter. His work on Dhamargava Phala and Dhamargava Kalpa, especially, Ikshvaku Phala, is really this. I don't have any experience with this medicine, but he has correlated it and he has worked extensively on this and has given very good result on that. So we can make use of those things, and we are all very much useful to with this knowledge, I can say. Effect of Vamana and Virechana on dyslipidemia. That Vamana and Virechana with the, while giving, before giving Vamana, Snehapana with the Tilataila, Snehapana with the Gugulutikta Agrata. So these two studies have given moderately good results. We cannot expect more like statin, but with one Virechana only, I mean that in 10 days, within 10 days only, the moderately reduction in the all cholesterol and good cholesterol is slightly increased. That is positive things only with Tila Taila. Why Tila is Shrestha in Ayurveda is, I think, in Vataroga especially, this is going to lead Vatarogas. So this probably, because keeping in this mind, the Tila is Shrestha, he might, Charaka might have, or Ayurveda might have experience with that. So regarding Vamana and Virechana, my concept is little deviating here. So if possible, you can make use of it. My experience always, I would like to say my added experience also. Here, the Snehapana drugs which we have given, whatever it is, the Snehapana, Tilataila or Gugulutikta or some other drugs, this works more rather than Vamana or Virechana. You can just, not only in this state, you go for psoriasis. So in psoriasis, if we go Snehapana, on 7th day, the patient's psoriatic conditions, skin lesions, will disappear 80%, 75 to 80% of the patients, excluding non-diabetic patient. There will be no response soon, very immediate response in the case of diabetic patients. But in cases of Vamana Virechana will be the same everywhere. But why I am giving example here means lipids without Virechana, dyslipidemia without Virechana, with Virechana we should study. Therefore, we can understand that whether the effect is of the Snehapana only or effect is with the Shodhana as such. Because he has mentioned about the Drava Kapha will be eliminated Really it is with the Dravakapha elimination or with the Snehapana itself. Every level of the procedure of the Snehapana, Vamana, Virechana, we should study. That is very important, because if the drug is working, why should we give Vamana? And sometimes Vamana patient will not be unfit for Vamana. In those cases also, with only Snehapana we can manage, and a light, moderate Harita Kichurna with light Vamana Virechana can be given. So this is the added benefit of that, what I am mentioning. About the Lekhana Basti, really it is a fantastic one. Scientifically can be explained. The Basti given, the drugs given through the Basti, directly go to the hepatic vein, through the hemorrhoidal vein and to the hepatic vein, and thereby it goes to the heart. And then immediately within half an hour it is circulated all over the body. Modern science says this. We should make use of modern science at this level. However, Basti, Anupravana Bhava, that Bhava, this Bhava, we say many things. But practically how it works, that is very important. In those days, we never had the modern technology. We could not assess the drugs from how it is absorbing, where it is all traveling, and how it is giving the result. We were not knowing those technology in those days, so that we were depending on clinical observation alone. Therefore, we were unable to detect at particular level only the drug is acting. Now we can do it. So that the modern physiological aspect of Basti, I mean how much the Basti drug given to the enter into the Pakvashaya. So how it goes to the circulation, blood circulation, then through two ways it goes, but one way is superior hemorrhoidal vein, hepatic one, and then to the heart, and thereby it's distributed all over the body, and quick action will be there. This is how the Basti Shodhana it is called, but whether it is Shodhana or Shamana, afterwards we shall decide. But the drug action on Basti is really marvelous, and the drug action is quick, and it goes like this. So there will be no Vamana Virechana at all, the tedious job. So the Basti, she is a marvelous work he has done. So I too believe that this Basti is very fast acting procedure. Regarding this decrease of cholesterol as well as increase of good cholesterol, this also being observed. Shamana Churna, like Musta Churna, Triphala decoction, it is good. I can make use of this in my practice also, because I have not done this, so I can make use of it. Overall, what I would like to say is, some say very classically you should adhere to the Ayurvedic. Research also should be conducted in the manner of Ayurveda only. For this, I have a different opinion, always. Because fat can be visible, is visible everywhere, on the body, on the abdomen, on everywhere. So, of the body. But how about the cholesterol? How about the lipids? Can we judge it? Is it possible to measure it? This much of cholesterol is there increase. How can we study? So that we have to adopt the modern technology. And when we correlate with the modern, whenever necessary. But I don't say that we should depend on totally on it. But on the other contrary, I say that modern science is developed on the basis of the Ayurveda only. I can prove, I can talk at length, hours together, to say that they are modern science totally dependent, and development is only because of the Ayurvedic concept. But because of not having technology, we were unable to give detailed information. We were lagging behind. Otherwise, if we borrow the technology, definitely we will go further, more faster than them, we can say. So here, I would like to say some of the important points. The cholesterol or the HDL, LDL, all these factors, whatever discussed in the morning, we were doing it. That is going to cause cardiac disease. That is going to cause stroke. That is going to cause so many other peripheral disorders, many others. And why we were unable to control the stroke? That concept were not there in those days. So we adopt this hypertension. When we adopt the concept of hypertension and give over treatment, we will be more successful. So indirectly what I am saying is, don't deny the concept of accepting the technology, please. Otherwise, the Ayurveda will never develop. Like every aspect, I can say the modern science has developed based on Ayurveda. One example I will give you, only one. I should not take more time. Actually, it is a concluding. I should not take, but still, I'm inspired by his speech, so that I'm telling. This nebulization theory is from Ayurveda. This nebulization theory is from Ayurveda. It is not me or you. Modern science is only telling this was practiced earlier, this nebulization, this. It was called as therapeutic smoking. Why? This is out of the topic, why I'm telling. Just to say that modern science accepted almost all the principles of Ayurveda. Even now they are taking our methodology, all the aspect of the science. So we should not hesitate to take their technology. It is technology is not from modern medical science also. It is a modern science, not medical science. They are also taking the modern technology. So many of the students have discussed in this manner, so that I am frankly telling you, don't hesitate to accept the modern technology. So that we can prevent now, we only can prevent, Ayurveda only can prevent CAD, coronary artery diseases. Ayurveda can prevent stroke, and Ayurveda can prevent, because we were also not knowing the diabetic condition, stroke will be more in diabetic condition, CAD will be more. So now by that knowledge we can say that even in that case, modern science say that. So though the risk factors are involved, statins are given there. The risk factors means there is no lipid increase in the lipid at all. If the patient has crossed 60 years, and lady 55 years, something like that. I'm not exactly correct. So cross that family history is there, and somebody is died due to CAD in their family below 50 years age. This is the risk factor. And if he is an alcoholic, is a risk factor. Smoking is a risk factor. Diabetic is a risk factor. If all the risk factors are there, we could start even without lipid profile even without lipid levels are increased, we should start hypolipidemic drugs of Ayurveda. That is what I would like to give the message to you, that my experience crossed 70 years now. So 50 years of experience in Ayurvedic field says of my own, maybe different person has different experiences. But even though there is no lipid level changes, there is no dyslipidemia is there, still we should start hypolipidemic drugs. That is the message of the modern. I would like to accept it and prevent the diseases of the CAD and stroke and many more other related to the metabolic disorders. I thank the organizers for giving me this opportunity to share my thoughts also. And once again, I congratulate Dr. Santosh Kumar for his voracious work, very good work. I appreciate it very much. Thank you very much.
Thank you, ma'am. So now I call upon Dr. A.S. Chandrasekhar, sir, Senior Physician, Mysore, to felicitate our resource person.
Madam,
Yes, ma'am, please. Yes, ma'am, please.
all dear students, can you sit straight? With energy, can you clap for Santosh Kumar sir? It was a great presentation. Actually, sir has covered each and everything, like how the clinical presentation and the treatment, and also with the research evidence. Really, it was a good talk, sir. Thank you very much, sir. And also, it is a great opportunity for me to stand in front of my all respected teachers and my one of the favorite teacher Aruna ma'am, and also after 25 years I have heard madam and grateful to you ma'am. And in my practice also we are doing the one cardiac OPD every month, and we are taking the cases even from the 20 years we are seeing the many hyperlipidemia cases. And maximum cases, all lipid profile will do, 75% of the patients are having the hyperlipidemia. Even we are practicing with the village nurses, and we are getting the very good results with that. And I'll proudly say that all Ayurveda doctors, by conducting the Shodhana, we can prevent maximum cases of MI and also the stroke and many more disorders which are from the hyperlipidemia. And I really thankful to the organizers to sit with my madam and also in front of my teachers. Thank you, Satosh Kumar sir, once again.
Thank you, ma'am. So I request Dr. Chandrasekhar sir to felicitate our speaker. Huh? Now I request sir to offer token of gratitude to our chairperson and co-chairperson. Thank you, sir. I thank all the dignitaries over the dais for conducting this very insightful